It's sat empty since it was built in March. Beds and equipment ready to receive an influx of COVID-19 patients.
The great thing about having our pandemic response unit at Joe Brandt is that we haven't needed it yet.
The Pandemic Response Unit, or PRU, outside Joseph Brandt Hospital in Burlington, was built as a backstop in case of a COVID-19 surge. But the surge never came, and the 73-bed unit has never been used.
We're still below the provincial average for infections here in Halton. Even though our numbers are going up, there's still nothing like the hotspot areas around us.
Right now, Joe Brandt Hospital has only 2 COVID-19 patients, both being housed in the main building. And there are only 6 patients in hospitals in Oakville, Milton, and Georgetown. But 664 beds are ready, and Halton Healthcare Hospitals say it is able to create more room if needed. We have created additional capacity at Milton District Hospital to assist with a surge in capacity. There are also 3 shelled-in areas within Oakville Trafalgar Memorial Hospital that have been identified for potential internal field hospitals. With cases increasing, Premier Doug Ford has hinted Halton may be the next region to be rolled back. And Ontario's Associate Medical Officer of Health, Dr. Barbara Yaffe, said Monday Halton is being closely watched. CHCH News Queen's Park producer Randy Rath asked her why Halton is being watched for a potential rollback, despite the large capacity for more patients at hospitals like Joe Brandt.
I can't speak to that one in particular, but I mean, the hospitalization rates for COVID-19 are slowly going up. They haven't hit a serious point where it's impacting on other patients, but that's the concern.
Joseph Brandt Hospital says the PRU is a regional resource and so far hasn't been asked to accept any patients from outside our area. So it remains on standby, ready for a second wave surge if one ever comes. Matt Ingram, CHCH News, Burlington.